Right. All right. Hi, everyone. Good to see you all. It's mid-May already. I don't know about you, but I cannot wait for this term to be over. I see some people nodding. I'm counting down. Um, uh, my final assignment for the class I'm teaching right now is due tomorrow, so I'll be grading the rest of the week for my people who are graduating. So anyway, it's an exciting time of year. I also want to acknowledge, as always, there's a lot going on in the world, certainly, and all, and by world, I mean also our local communities, our campuses, and just hope everybody is finding ways to lean into being safe and peace, and taking care of yourselves in the middle of everything. And so reach out if I could be helpful, always here for you all, and lean into this community as you're able to. So big sigh. Wanted to just begin by just starting there, and then just inviting people to share as we normally do. This is our last time together in the year one experience before we head into Summer Institute. So we'll come back to that before we wrap up today, but let me just begin by just asking if anybody wants to share some news either in the chat. I'll keep an eye on that, or want to come off mute and share with the group. What's some things you want to lift up? All right. Oh, we got first peer reviewed paper, and thank you for dropping the link in the chat. Yes, congratulations. Awesome. Awesome. That is great. Yay. Congratulations. That's awesome. Please send it, if you haven't, please send it to the HPRS box, so like we can also lift it up too and put it in the newsletter if you're feeling comfortable doing so. We want to celebrate everybody, so congratulations. All right, what else do I see here? Won an award for outstanding research in psychology that has implications for applied fields. Congratulations. I love, and thank you for lifting up HPRS. Glad that you feel that we're able to support that interdisciplinary work. That is awesome. Congratulations. Oh, wait, it's moving too fast. Another award. What's this one? Oh, no, wait, let me go back up. Outstanding graduate student. Congratulations. That's awesome. I'm loving seeing all this. This is dope. Abstract accepted for a conference in Barcelona, Spain. Oh, wait. Oh, where'd that go? Congratulations. Oops. Nothing to uplift. We uplift that you're taking exams next week. We celebrate that too. That's a milestone. So congratulations on getting to that space. We celebrate all of those milestones. I want to say congratulations to everybody, for people who have milestones coming up in your program. Celebrate getting to that place. Doctoral journey is a journey. I say that as somebody who has been there. I've been on the other side. Celebrate every one of those milestones for sure, because they are major. Let's see what else. Research fellowship from Berkeley Grad Division. Congratulations. I missed that before. This is great. Thank you so much for just sharing with your community. And again, this is something that will continue throughout your time here. This is something we lift up, we normalize sharing, because as I've said many times, people who look like us, come from our backgrounds, don't always tend to celebrate our accomplishments. And I think it's important to do that. And I've had many times scholars have said to me, I don't want to brag. I'm like, it's not bragging. These are facts, right? They're facts. So we celebrate facts. And we'll continue to do that when we're together. So this is excellent. Congratulations to everybody. And if you didn't share something in there that you have going on, that's okay too. We celebrate things that you didn't lift up as well. So thank you. Last class, yes, we celebrate the end of the term. Got your MS. Awesome. I don't know what NCORE is. I assume that's a professional conference. If anybody's going to NCORE, please respond. It's always nice to connect with other scholars when you're at meetings. So more comprehensive exams. Awesome. Oh, okay, thank you. National Conference on Race and Equity in Higher Ed. Got it. All right, thank you so much. So if anybody's going there, reach out to Mir. Awesome. Congratulations, everybody. Again, thanks for sharing so much what's going on, and feel free to continue to put some things in the chat if you're interested. All right. Thank you. As I said earlier, this is our last session. Can you believe we've been meeting since October? Maybe it has felt long. To me, it's flown by, but I truly love you all, and so I want to just start there and say it's been a real privilege and an honor to be in a space with you since the fall. And you're not getting rid of me, but like this is we celebrate the journey, right? So this is our last time together in this forum. We'll spend some time together during the Summer Institute. And then you will begin your year 2 experience, which is similar to this one, but really leaning into policy communications. And we'll talk more about that in a little bit. So I'm actually going to just not even share my slides. I can just tell you the announcement. So the first thing is that a few of you have asked, because of the busyness of the year, if you can have more time to submit your problem statement. Yes, that's fine. So I will just say, please submit them to the portal today, tomorrow, anytime before the end of the month, right? So you have a few more weeks, because I do read them all, and I'm going to give them back to you when we get together for the Summer Institute. So I need some time to do that. So submit them by the end of May. I'll take a look at them, and then we're going to pick them back up when we're together at the end of June. So there's a way in the portal that you can go on and upload your problem statement. If you want to, we're going to have some time together today to be in some breakouts to share and to talk about it with others. So if you want to submit it today, that's fine too. But you'll have a few more weeks if you want to take that additional time. And again, I know it's a busy time of year, so I want to just acknowledge that and give you all some extra time and space to do that. And there is an example of a problem statement also on the portal. You'll see, again, the kind of thing we're looking for, just, 250, 300 words or so. So that is there. The other thing is, if you are missing a session, if you've missed a session in the year, and I have not sent something to everybody saying this is something I need to do this weekend, forgive me for that, but just to make sure people are caught up. There are a number of sessions had some brief prompts. So for example, if you missed Corey's session last time, which was excellent, there's a prompt there, so you can watch the session and then respond to the prompt and post a response in the portal. So I do look at all of those as well. And again, do those by the end of the month. And it's important for being in good standing in the program. So please, if you have an issue meeting that deadline, reach out to me. But let's have everything in by the end of May, so I can take a look at all those in the first few weeks in June before we get together at the end of June. Speaking the end of June, we'll be in person for our Summer Institute. As I said, this is the first time all 4 cohorts are going to be together, which is a little overwhelming for the team that's planning this, and also exciting. And so I want to just name, we'll have cohorts 4, 5, 6, and 7. And by the way, we're in the middle of picking cohort 8 right now. So they are deep in their interviews. I'm sure you all remember that time last year. So we are going through the interview process right now. And we'll be reaching, and coming to the conclusion of that next month in June for cohort 8. Yes, it was a year ago. That's what I'm saying. Time is flying. Let me pause and see if anybody has any questions about problem statement, missing sessions, June 23rd. Everybody good? Have you all responded about travel? Everybody set? Any questions on that? There is an example posted on the portal, and I could actually I can pull it up to show people. Yeah, Kayla, you have a question?
Yeah, I just wanted to confirm, did we need to send our travel details to someone somewhere, or no?
So there was an email with travel, and it had asked something. I did not it was from the survey, and then it had so did you completed the survey?
I completed the survey,
Okay.
but I don't think it asked about the specific travel details.
Okay,
And
I
I
think the travel just asked about a couple of things, and so you should, as long as you should be getting something soon. And so I just want to make sure everybody had completed their survey, because we give that stuff to the travel agent.
Okay.
So
Cool.
all right, very good. Thank you. All right, let me for everybody who's asking me about the sample problem statement, let me just pull up the portal and tell you where it's at. So if you go, it might let's see, my view is a little bit different than yours. So let me try to see if I can go to the view that you all have so I can. Okay, yeah, all right. So let me go ahead and share my screen and just show you where. And I'm gonna hope that your screen looks the way that it looks for me right now. So give me 1 second to do this. All right. All right. So this is how your screen shows up for me, where you can go to cohort 7, year 1. And so here's all of the sessions. And so if you click on the one that says submit your problem statement by 11:59 p.m. Eastern time on May 31st, you click on that. And here's the description, and here's a view, a sample problem statement here. It's linked. And then once you do your statement and really looking for 1 to 2 paragraphs, really brief, 250, 275 words, you just upload it here, hit browse, upload, Word document or PDF, that's it. So it's right there. And again, it's just a brief sample problem statement. And we will work on this and we're going to turn this into a policy memo, and we'll have time together in June during the Summer Institute to continue to work on it. And we'll talk more about putting that policy memo together. Okay. All right. So that is where the example is. Okay. And I don't think I see any other questions. All right. Okay. Let me just jump right in then, and we'll go into today's session, which is one of my favorite topics, which is policy engagement. So what I'm going to do today is, and let me just walk through the slides, and I did not post them already, which I just forgot to do earlier this morning, but I'll post them right after the session. So let me go ahead and share my screen, and we'll just jump right in. So what we're going to do together in our time, what we're going to do in our time together today is I'll talk a little bit about policy engagement. What do we mean by policy engagement? I'll give you some tips about engaging in policy. And then I'm going to talk to you a little bit about some specific tools that, that my team, we've been using to engage in policy, to help policymakers think about moving forward with more equitable, health promoting policies. And then we're going to have some time where you go into some breakout groups and talk with your peers about your problem statements, just to get some feedback. And then we'll wrap up our time together today. So I wanted to begin with this question. What are some reasons to engage in the policy process? Right. So, a lot of HPRS, and this was not an interview question, but maybe something similar to what we asked you when you interviewed. But, why do you think what are some reasons to engage in the policy process? And feel free to drop them in the chat or come off mute and just share with us. Because policy affects our lives, even when it's not obvious. Yep, absolutely.
I think we all know that the representatives in government do not necessarily reflect the people, including our sort of groups that we identify with. So it's important to kind of make sure that we make our voices heard, especially if they're not going to bring their own lived experience in a way that helps benefit those communities.
Yes, thank you for representation, to make sure that just acknowledging who are the people in office. Actually, I got my sticker on today's primary day in Maryland. I went and left in the middle of the day and voted. So for that exact reason, thanks for lifting that up. Let's see what else. Okay, hold on a second. Sorry, let me go back up here. Having a thorough understanding of how government operates to create lasting change and impact. Because policy definitions dictate distribution of resources, to better understand and advocate for our communities. Absolutely. Okay. Great. Thanks for sharing some of those reasons. And one of the things that, and I'll talk to you and I'll share a little bit about why I engage in the process. But one of the things, and Corey, I'm going to ask you to keep an eye on the chat for me, because I'm going to close the window and go to my other screen. One of the things I've shared with you before, that when I was a PhD student in the department that I chair now, before I left and I came back, I worked as an intern for an elected official in Maryland. And so during the time when I was writing my dissertation, I was in Annapolis working on his staff as his legislative intern, and spent a lot of time writing the same types of problem statements and policy memos that you're doing, engaging with constituents, going to community, surveying, going to community meetings, to understanding what people's priorities were. I mean, all of those activities were ways to engage in the policy process, and we'll talk about some of that today, but really resonate with what so many of you shared about reasons to engage in the policy process, and those are many of my reasons as well. And I've mentioned to you before with some colleagues, you wrote this book called Policy Engagement, which I'm very excited continues to be the #1 seller on APHA Press. And it's a book that we wrote for really public health professionals. My colleagues and I had all been in situations where we would be talking about policy and people would be saying, well, how do I do it? How do I engage in policy? So we wrote this book, and we lay out sort of just an intro to policy, things we've talked about in this class, and then we present some guiding principles about engaging in policy. And so I'm going to talk about those principles in a moment. And I'll talk to you a little bit about this chapter about approaching policy with equity in mind will connect to some of the things I'm going to talk with you later about tools to help to advance engaging with the policy process. So I want to just jump right in and go over some principles that we lay out in the book, and I'm going to unpack these and certainly welcome any comments along the way as I go through these. And so our principles are, the first one is policymaking is messy. It can be incredibly messy at times. How you engage is personal. Quote unquote, lobbying is not a dirty word, and we'll talk more about that. The importance of your message aligning with your target audience, and that policymaking takes a village, and nobody has to do this work alone. So let me go through each of these principles, and what I'm going to summarize is sort of themes that are under these areas in our book. So the first is around policy, in terms of policymaking being messy. And what we mean here is that policymaking is not a linear process. I can think about, I remember working on a bill on medical marijuana way back. The delegate I worked for had been proposing medical marijuana to make it legal in Maryland, which is a very progressive state, for a number of years. It was not getting out of committee. We continued to do a lot of press and tried to, we organized got people in and continued to try to move forward, and it still took a long time. And then finally, when it got out of the committee on the House side, it got stuck on the Senate side, and it needs to get out of both committees before it can get to the floor for a vote. And it just wasn't a straight process. And you would think something so clear, such as the medicinal purposes of marijuana, was something that people could get behind, but there were a number of reasons. Particularly, you kept hearing the argument of, well, once we, legalize marijuana, then, it's going to have all these other effects on other types of drugs. And needless to say, it was a long journey, but medical marijuana, is certainly legal now in Maryland. And what was critical about that principle, and what I want you all to hold on to, which is why I asked you that question, is know why you're engaged. What's the public health goal, or what is the goal period in terms of your work that you're trying to solve? And as I said just now, the journey can take a long time. And so the persistence of this is so critical, knowing we talk about sort of your quote unquote North Star, like, why are you doing this work? Because it is that deep desire for change, and to be a change agent, and to make things better for the communities we come from, to represent their voices for people who can't make time to engage in the process. All of that is so critical. And we know that passing a law, particularly at the federal level, can take a really long time, and getting good enactment or implementation can take even longer. And then finally, be strategic. And this is something I've learned in my work, that there are no permanent enemies or allies, right? So there are people who, on one particular bill, we may be on the opposite side, and it is very clear that we are not on the same side. And, there could be some sort of shared alignment that the next bill, that person who was on the complete opposite side of a bill we were moving forward, is our strongest ally. And so I just mentioned this word permanent as important here, because I think before I spent time in the legislature, I absolutely did not believe this. I thought, if you're an enemy, you're staying on that side. I'm not engaging with you. But it was clear that there are certain issues where there is alignment, even when you're on the opposite sides of the political spectrum. It doesn't happen all the time. And there are certainly people whose values were misaligned and we just did not engage with. But there are people, again, who I thought were on, who were always going to be on the opposite side, who ended up being a strong supporter for a bill where we saw shared goals. So that was the first thing. So again, policymaking is messy. It's important to just know that as we approach the process. And again, by policy, we're talking about federal, state, local, tribal, institutional. We're also talking about things like executive orders, a number of policies. So this isn't just public policy at the federal level with Congress. So as you get to the process later this summer of working on your policy memo, we're going to come back to all of these different levels where you can engage and where you're thinking about policy change. It could be that school board policy, again, all the way up to something at the state or at the congressional level. The second principle we lift up is how you engage is personal. And this, again, is so important. There's no wrong choice in terms of how you engage. All forms of engagement are needed. You might decide that you're going to engage by voting, or you might engage by writing an op-ed. And that's something else we're going to do in year 2 in HPRS. Get a chance to write an op-ed about something you care about, and we have people to help support and help those get placed. It's really important for you to don't do what you're not comfortable doing, you know, and I do think, though, to that point, consider stretching yourself a little bit. One of the things that we do is we have, created opportunities for direct engagement with policymakers. And I remember a long time ago, my very first visit, I was particularly to Congress, I was nervous, but it was an opportunity to have my voice presented to a different audience. And so I encourage you to think about how you can engage in the process. And some of us, it's by working with advocacy organizations. It's by working with other community level organizations that are moving forward an issue, or some it's more direct engagement. And the point is that all ways of engaging are needed because I tell you, as we have seen all across the country, people who are trying to continue to oppress communities, who are trying to lift up and uphold racist structures, are engaging regularly. They are regularly and strategically engaging. And when we are not, our voices, our narratives are not being heard. The third principle that we lift up in our book is aligning your message with your target audience. And I mean, this really just is very, all of these are very explicit. And the reminder here is to certainly, the importance of your credibility and the importance of being authentic as you're engaging. We're not asking anybody when you're engaging with policy to not show up as who you are. We're asking you to certainly speak from your perspective. If you're coming in as somebody who has a story to tell or knowledge, we're not asking you to pretend to be somebody else in that process. Your credibility is so important. And in doing that, we know that it's important to stick to the facts and the evidence and real world experiences and our own journeys. And it's totally fine when you don't know something to acknowledge it and say you don't know, and then follow up with that person to get back to them. Certainly being a credible voice is a way to build relationships. And I have found I have relationships with policymakers who call me to ask me for things because they know that I'm a credible voice on a particular issue. We also talk about lobbying not being a dirty word. And I think this is really important. We meet so many people that say, oh, I can't engage with policy because I can't lobby. Well, all advocacy is not lobbying. Some advocacy may be lobbying. You cross the line from advocating and educating into lobbying when you're talking about a very specific bill, when you are focusing on a specific outcome. So it's important just to know the lobbying rules as you engage. And what we tell people is the fears around lobbying are not a reason to avoid engaging. As a a citizen of this country, you are well within, or a resident of your area, you are well within your rights as an individual person of engaging in the process. I oftentimes engage in our state General Assembly, and I testify, and I use a disclaimer that I am, yes, a professor and a chair of a department, and I'm representing myself. It is rare that I go and represent my institution unless I'm asked to. And then there's sort of a different set of rules. So the important point here is to just know the rules, particularly of your institution or your organization. And they vary. It's just important to know what you're allowed to do and what you can't do. But it doesn't, I encourage you not to shy away from engagement because you're worried about lobbying rules. And finally, the principle we lifted up, the last principle is policymaking takes a village. And I mean, this is really, I think, a good reminder that we don't need to do this work alone. Find your people. There are organizations out there that are effective and credible in the areas you do work with. And I hope that you found your people, you find your people, and you align your efforts. Also, policymakers, many of them, particularly at the local and state level, have limited staff and limited staff who are sort of full-time, and they are eager for people who have expertise and have knowledge. You all are doing research on different topics. Your policymakers typically won't have people on their staff with that level of expertise that you have. So we encourage you to, engage with your policymakers and be a resource. And we'll spend more time in the summer, during the Summer Institute, and then moving into year 2, talking more about this. So I said that I would talk a bit about just why I engage in the policy process. I mean, I engage in the policy process because I truly believe that I can help to change the world. If I didn't believe that, I wouldn't be in the position I'm in. I think I've shared with you before, I'm grateful to my grandmother, who always told me that I am here. I was made on purpose and I'm here for a purpose. And part of my purpose is to make a difference. So I want to just to name that. I do this work because policy is so important. And the fact is that people have made the policies that harm us, so people can make policies that help and promote and undo those harms. And so that to me is so critical. So let me pause here. I see Alex, Alex, you have a comment in here about step 5, finding your people, finding your village. I don't know if you want to say anything, or is maybe what you wrote in the chat is enough, but I do want to give you an opportunity to elaborate a bit if you'd like.
Yeah, I think no matter what someone may be advocating for, or if they have a passion population through either research, lived experience, or just professional curiosity, yeah, when you find your people, it makes you realize that no matter what you're advocating for, that you are not alone. And once you kind of hit home and find your people, the sky's the limit for your advocacy, and you kind of want to keep doing that. And yeah, that's just, and it's made, like, it's helped me personally to also realize that there are other people who are affected by these issues of psychosis or bipolar disorder, or any type of mental health condition or mental illness. And it's just like, yeah, that step alone has made all the difference, and has given me the confidence to share my story, help others uplift their voices to share their story. And so that's just been a game changer for my profession and my education. Thanks for allowing me to share.
Yeah, thank you, Alex, for sharing. Really appreciate you naming that. And I think that's such an important point, particularly for anybody who's a little reticent to engage in policy, just acknowledging that we have allies out there and people who are working for similar causes with similar values. And it might not always be apparent who those people are, but finding them, I think, is just so critical. So thank you for that. So within those principles, one of the things we talk about and do in HPRS is thinking about how do we take our research and translate it into to inform policy. And so I want to talk to you a little bit about a few areas that I do work in where we're doing this, and my team is doing this. And you may have heard me talk before about one of the challenges in sort of public health or policy is that many decisions that affect our health, that are tied to health equity, are made outside of the health sector. So all of you are representing either, health disciplines, non-health disciplines, working in various sectors. I'm sure you can think about how the sector that you're in affects health. And that's where we started this journey of HPRS back in October. And we talked about sort of those interdisciplinary collaborations. And so the challenge with this is that we know that decisions that are made by our colleagues in the housing sector or in energy or in transportation have significant implications for health that may go unrecognized, that often result in unintended consequences. And so what we end up doing is figuring out, well, how do we actually address that? What are the solutions? Well, thankfully, there are a number of solutions. And this is where I spend a lot of my time scholarly, and that's advancing tools that promote health in all policies. Have people heard of health in all policies before, aside from me mentioning it? A few, okay. Okay, all right. So health in all policies. So we'll unpack that in a moment so everybody's on the same page. One of the things I want to share is we just had this convening. I had a conference award. We actually just did this convening on Friday in DC about advancing health in all policies. And we brought together a number of people across the country that are doing work in this space. My center at Hopkins hosted this. And part of the excitement is that there are a number of tools out there that are achieving this on the ground. So people hear this phrase, health in all policies, and they ask, well, how do you operationalize it? So I'm going to talk to you today about a couple ways to operationalize it. And here's the definition. So health in all policies, the acronym is HIAP. It's actually pronounced HIAP. So when I say HIAP, that means health in all policies. And health in all policies refers to integrating and articulating health considerations into policy across all sectors and all levels to improve the health of all people and all communities. So what does this mean? It means it's a collaborative process. So it means that we are talking about integrating health considerations into policies that are moved forward by the local planning department or the state housing department. Like this is what we're talking about. How do we systematically and routinely consider health when other sectors are making decisions? Health in all policies is data-driven. So this is about using data that are available or collecting data, and by data, broadly defined, I mean quantitative data, qualitative data. I'm thinking about various types of data to inform how we might actually promote health and reduce harms. Health in all policies is a systems level change. So for those of you who do system science, we're talking about how do we sort of pull levers and sort of those systems loops and systems mapping in order to create change. This isn't a one-off, let's just make a good decision, but it's how do we change the way we do business? And because of the focus on these other sectors, HIAP really seeks to address the social determinants or the structural determinants of health and root causes. And so we're looking at ways that we can address policies that might come forward related to housing, for example, that may be also racist policy. And how do we actually lift up the way that health ties to that policy and try to make changes that will improve health and not harm health? And this data-driven part, I think, is really important because a number of the tools I'm going to talk about, we need to have the data to actually begin to say, how could health be impacted? I've studied health in all policies, written papers on health in all policies, and here are some of the key elements we've seen. And let me also just acknowledge that health in all policies is not a new concept in the in the global sense. There have been for decades, we particularly outside the US, have seen conversations and writings around healthy public policy or thinking about healthy policies. That's what we're talking about. I also want to acknowledge that when you look at other high and middle income countries, this type of thinking is so embedded into a lot of decision making. We can look at examples, particularly in Canada and in the UK and in Sweden and in other areas where there is increased focus on social policies, investments in things like universal healthcare, for example, parental leave. I have a colleague who's in the UK who has paid leave for a year. That is unheard of in this country, right? And so, but that investment in the time for the parent and a new child, they know will have long-lasting implications for health and for quality of life for the parents and for that new baby. And so when we look at HIAP, we see that where HIAP is most successful and most impactful, it's where there is an explicit focus on health, equity, and sustainability. It's where there are ways to support interagency and intersectoral collaboration. So for example, think about a memorandum of understanding. It's also about creating co-benefits for multiple partners. And what do I mean here is that if we are asking our colleagues in transportation to work with the public health department, each side needs to see the value and benefit for achieving their sector goals. And this is important. I've talked to colleagues in other sectors that say things like, Keisha, we don't, health is important, but that's not what I'm evaluated on. I don't get a bonus based on health metrics. And so tell me how it's going to help me achieve my goals, and then we can talk about it. Health in All Policies also engages a broader array of stakeholders. So we think about representatives from different sectors. We think about members of the community. We think about other academics. So really involving a number of individuals in their perspectives. I mentioned already, it creates structural process changes and then also uses various types of data. And we know from research on HIAP, we know Health in All Policies can achieve health equity. People may have seen this image. I think I've shown it before. This is the RWJF, sort of difference between equality and equity image here, where we are focusing on health equity, where everyone gets what they need, understanding the barriers, circumstances, and conditions, as opposed to an equality approach, which gives everyone the same, regardless of whether it's needed or right for them. In some instances, health equality is important when we think about things like access to vaccines, for example, but certainly there's equity considerations there as well. But we've seen a lot of evidence where HIAP can help to achieve health equity when implemented well. I want to say that, right? Implementation is so critical here. So there's a number of tools and tactics to achieve Health in All Policies, and like there's no one single way to quote unquote do this type of work. And so we've seen examples where there are new cross-sector government structures. So for example, many years ago in Baltimore, the health commissioner, as part of Health in All Policies, created something called the CAT team, which was a cross agency health task force that involved representatives from each city agency coming together with health to talk about decisions, projects that were coming up, where they could then talk about those health impacts, mitigate those harms, promote the benefits of that project for health. We've also seen examples of health being integrated into planning processes. So for example, a city might need to update its zoning code about how land is used for whether it's commercial or real estate, or housing. So there's ways to center health in those as well. There was an HIA here in Baltimore many years ago that I helped consult on. And one aspect was thinking about the density of alcohol outlets, for example. That was part of what was a recommendation to include that in the zoning code, to think about was there a certain limit in terms of the concentration of alcohol outlets in areas. We've also seen development of health-related grant scoring criteria, integrating health language into requests for proposals, and then conducting health impact assessments and related tools. And this final point is where I spend a lot of my time. I created a course on health impact assessments about, I don't know, 12, 13 years ago, and have written a lot about this and helped to create some new tools where we can help to codify the goal of having Health in All Policies. So we'll talk a little bit about what this looks like. So if you've heard of health impact assessment, here's one definition. There's a professional society called the International Association of Impact Assessment. But really, I want to just show this definition, very similar to many others, but what we think about with HIA, and that's health impact assessment, is doing an assessment of all of the ways a proposal can impact health, before the decision is made, right? So this is not the same as evaluation, that the decision is made and we're going back to see what the impacts were of health. This is more prospective. And so what an HIA does is that it will say, okay, here's a proposed policy. Let's look at all the ways this policy can impact health in a positive way and in a negative way. And in doing that, what we end up doing in an HIA is that we make these recommendations that are grounded in the evidence to then try to inform a better decision. And so I've spent a lot of time doing HIAs, have done very comprehensive ones that have taken a couple of years on big federal legislation, right down to ones that have been more sort of short and rapid. And I'll give an example of that in a moment. But this is really a way to codify health in all policies. Because what we're doing is we're saying, let's look at those proposed policies, plans, projects, and other sectors, and think about how they can impact health. I've had students work with me on projects related to HIAs. A student, one of my students right now, for her dissertation is looking at HIA implementation in the oil and gas sector globally. Again, so really interesting ways that we're seeing these tools used to help to promote health considerations. HIA is pragmatic, like it's not about an academic exercise that sits on the shelf. But really it helps to illuminate short-term and long-term health benefits and risks of projects. And it's also a way that I think can help to promote efficiency by ensuring that dollars are used to promote the greatest benefits for health and equity. And again, not harm. We want to mitigate those harms. If you're interested in HIA, just a little bit more about it, here's a sort of structured process that we use. And there's a number of different ways of doing HIAs, but these are the general processes where you're screening to identify the topic, you're defining the scope of the analysis, you're doing the assessment, writing the recommendations that are based on the assessment, and then you're reporting out. And that's usually the process, and then you monitor and evaluate what you've done. One thing I really appreciate about HIA is the assessment step involves a variety of methods. So almost every HIA will have some sort of literature review, whether it's a systematic review or a scoping review. They also can involve quantitative data, economic analysis, qualitative data. So we've done focus groups, interviews, narrative review, document review, a number of things to really try to understand what are all of the ways that proposal related to housing, energy, transportation can affect health in a positive and negative way. So we want to use a variety of methods, including core values and lifting up core values, which are engaging with the community and other stakeholders and centering equity. I mentioned that HIAs can be a variety of sort of scopes, right? I mentioned a very comprehensive one. There are these sort of set of HIAs called rapid HIAs, and I do these actually quite a bit. And these are pretty popular. And what's important about these is that these rapid HIAs can be done fairly quickly. And again, we want to inform the decision. We don't want to have the decision made and our analysis comes afterwards. And so typically for a rapid HIA, the assessment step will involve some rapid literature review, some data synthesis. I have just in the fall finished phase 1, early this year, I should say, finished phase 1 of a rapid HIA, and we're going into phase 2 now. And this is an interesting one. So there was an RFP put out from our state for projects or contractors to help with the redevelopment on the west side of Baltimore. And so this transportation firm who I've worked with in the past called me because this call for proposals asked for expertise in health impact assessment. And so they called me and I went in on the team and what we were able to do is by attending community meetings in West Baltimore, engaging with the residents, had a chance to talk to them about what did they see as the way health would be impacted by this new development on this corridor. And so we also had a chance for them to do some mapping. We did some surveys. and really talk to other sort of key knowledge holders in the community about all the ways that health could be benefited. So they lifted up things like affordable housing, new grocery stores, and then what were the harms they were concerned about? And those were things like crime and loss of sense of community and social cohesion. So those are the kind of things people lifted up. And what we did was we put forward recommendations to the group overseeing the development about the ways that they could promote the health benefits and mitigate those harms that people lifted up and that were grounded in evidence. And I know that was a really brief overview of HIAs, but if you're interested in actually learning more about this, I encourage you to check out this website for People, Place, and Possibility, IP3, at hiacommunitycommons.org. And you'll see this image here is from the website. You actually can browse HIAs. There's over 450 HIAs on this website that have been done by people in the US over the last 20 years. And you can search by different sectors, and you can look to see, what's been done. You could look in your region as well to learn more about HIAs. Let me pause for a second before I tell you how we built on this concept of HIAs to meet sort of a need that we saw in the policy space.
Keisha, I have a question. Do the HIAs vary much from disparity impact statements?
Yeah, Tevin, thank you for the question. So not much, but the variation is around the focus, right? So there's probably about 50 different impact statements out there, right? So there's disparity impact statements. I also do racial equity impact statements. There's also gender equity impact statements, a number of these things. And so the focus is gonna differ a little bit. And so if you, so typically a health impact assessment will lift up sort of those human health impacts, but health broadly defined, right? So physical health, mental health, spiritual health, emotional health. And a disparity impact statement may not be as comprehensive on health, and it may also look at other disparities. Same thing for a gender impact assessment. They're going to be focusing on the impacts by gender. A racial equity impact assessment will be focused on, will the decision exacerbate racial inequities? So the focus varies, but the methodology the steps may be fairly similar. And again, there's so many tools out there. And so it's, I tell people, think about what's the right tool for what you want to get out of it for the context, right? In order to inform the decision.
I just had a quick question. I just wondering, so I know that we're thinking through this from the lens of also like health and all policies. And I mean, that can be a lot of different or sort of sectors that aren't health. So I guess I'm just curious, I guess in your conversations with folks, trying to bring this sort of methodology there, like, do they feel qualified to, talk about like, oh, here's what I think the health impact is, and how do you, I guess, like overcome that initial barrier where folks assume they might not have the topic knowledge about dealing with like health? Yeah.
Appreciate that question. So some people, I think this is the short answer is partnerships are critical. Like, this is why we need to work together. So most oftentimes somebody in another sector will engage somebody in health in order to do this work. There are a few jobs out there that are embedded. So a colleague of mine is a health person who is embedded full-time in a transportation department in order to do this exact work. So a transportation department wanted a health person to bring that lens to that sector's work, right? And so she's able then to collaborate and partner with the transportation professionals, bringing that health lens. Certainly having some knowledge of social determinants of health is important here. And what we end up doing for our HIA is also that process of communicating clearly and working with the partner so that therefore they're able to take the information and share it with the decision makers. But we often, Alexander, do it hand in hand. So like we were reporting together, right, at the same meeting where there's adding, I'm adding, but the partnership is so critical here.
I also have a question, kind of relates to what Alex was just talking about, the training, particularly in policy in different sectors, right? So, I'm trying to I've been reading a lot about theories in the political science, like the kingdoms theory and punctuated equilibrium and things like that. And it's so interesting that we don't learn about these things in other sectors. And so my question is, these political science theories, and they may be completely unrelated to the HIAB framework that we just learned about, but are they in any way, shape, or form related? Or because you just mentioned about there was an RFP and we jumped on it, and that kind of speaks to like these windows of opportunity that we learn about from political science. But is there training in, like, from your conversation with other folks, is there training along these different types of theories and frameworks so that we can start utilizing these tools to apply them into our research?
Yeah, so there's a couple things I want to unpack. So the first thing I'll say is in terms of Kingdon and other theories, how those resonate with HIAP is as we think about Kingdon's theory, for example, if we want to influence policy, there are certain places where we could bring in those data to inform what's happening, right? Like, so the understanding Kingdon's theory in terms of, as you just noted, when the window is going to be open, or the role of the policy entrepreneur or other individuals in that model, that can help us think through, well, how do I actually bring the evidence to the policy process? Or how do I know or know that window is open, or other things? Like, it helps you kind of think through how do you bring the health data or the equity data to the process. Now, the other part of your question is really important. So typically, no, the answer is no. Like, so our colleagues in transportation aren't learning about Kingdon. But what I have learned from them is that I need to know their policy change process, right? So I need to understand if we want to change or inform what's happening around the design of a road, what's the process to actually change the local ordinance? Who owns that road? Or is it the local DOT or is it the state DOT? So I have to understand sort of how change happens in their sector in order to help inform those changes. But by and large, they're not learning about the types of theories that we may have the privilege of learning about from political science and other frameworks. They're just, I think from them, it's around, they will expect me to understand how change happens in their sector, because the last thing that it would really impact my credibility if I'm saying, well, you need to change this code, and there's no relevant code for that, right? And so that's where that's part of the work for the health and all policies, because a lot of public health people don't know those processes either. That's why the relationship building is so important here.
Thank you.
Yeah, you're welcome. Thanks for these questions. All right. Okay, great. So let me just say, to continue the story, so I had been doing health impact assessments for policies, and realized that even some of the most rapid HIAs weren't always the right tool. And so many years ago, after I moved back to Maryland and came back and joined the faculty, I rejoined the team for that state delegate I had interned for when I was a student. And in spending more time in Maryland, I said to a colleague, Maryland has all these fiscal notes for bills. So basically, there's a group that does fiscal analyses of proposed bills and the fiscal impact on the state. And I said, we need a legislative note. At the time, I called it a public health note, like a fiscal note. And therein began this journey to create these legislative health notes. So this idea that I had many years ago, I had some colleagues that we were able to amplify this. And basically, we took the concepts of health impact assessment and what we knew about the legislative process and created a legislative health note to advance health and all policies. And so this work started around 2017 or so, where we recruited some partners in various states and localities to be involved in a pilot program with us. We eventually created this methodology guide. A lot of this work came through my partnership with Pew Charitable Trust and the Health Impact Project, which was also funded in part by RWJF. And basically what we end up doing in our legislative health note is that we do a policy analysis. So we read the bill and we break down the bill in terms of what are the goals of the bill, how will that bill what will be the direct impacts of that bill, how will those impact the social determinants of health, and what are health outcomes. And what we do is for every single bill, we do this analysis and that we're pulling together the evidence. You see mention of court ruling on this. I'll come back to that in a moment. But this is the methodology we created to do a legislative health note. And we've done trainings on this. We did them in person before the pandemic. We've learned how to do this in a couple of hours online, and we've trained people actually across the country on how to do their own legislative health notes for bills in their legislatures, particularly at the state and at the local level. And in coming up with this methodology, what we do is we review the evidence and we come up and make statements about the strength of the evidence. And we adapted some categories from the closest tool out there, which is called a health impact review that we had evaluated. And so we'll have statements that talk about, the bill, if I can go back on the arrow, so these direct impacts and the health outcomes and what's the strength of the evidence between these. So we've done a number of these in a variety of states across the country. So the states that are here in yellow is where we've done direct training, and we've supported them doing their own work. We also had some partners in California, Ohio, and North Carolina that we worked with directly and they had some grants to do health notes. And so we did trainings with them and helped support them with TA on their own work. And then our team did work in Colorado, Indiana, and DC, where we've been doing these legislative health notes. And so again, we've been doing this work for a few years. We actually just evaluated this, and we actually have a paper that just came out last month that somebody in my team is the lead author on, where we found that people who had engaged with these legislative health notes thought that they were a useful way to advance health and all policies. They were easy to understand, particularly presenting nonpartisan research. We heard that the level of detail was really useful for people who cared a lot about the bill, which made sense. One thing we did is we did not include cost benefit analysis data in the health note. And that was because in all of the places we worked, there were other entities doing the economic analysis. And so as we're thinking about moving ahead, we're wondering if we want to bring that into our work. And certainly timing is critical. For a number of these, we've tried to get these done pretty quickly to influence the bill hearing. So the goal is a bill's proposed, we do this, we get it done, and we actually testify and present our findings and enter it into the record during the bill hearing. And so sometimes we want to do that at the committee level before it gets to the floor. And sometimes we've missed that committee level, but we've gotten it at the floor. So certainly need to figure out the timing for all of these. If you're interested in seeing these, we've posted every health note that we do on Hopkins website for the institute I run. So we have all of them through that were done and completed and testified on through 22 posted. What can I say else? So I will just say that we're continuing to spread this tool. And have been most recently working in Washington, D.C. at the local level with the city council, where now they call us and they ask us, would you consider doing a legislative health note on this bill? And by us, I have a team that I've hired who work with me, and we do these analysis regularly. So this is one way that we are advancing health and all policies at the legislature level. And again, doing this primarily at the local and state level. We've had some interests at the federal level. And actually a few years ago, I worked with somebody in the House on a bill that was moving forward that was going to do some feasibility work, creating a review of these tools. And we were really excited, and the bill had gotten introduced. And then this person was not reelected. And so the bill did not get out of the House before their term was up. So they lost their election. And so ultimately, we're just trying to find some other champions to do this work. So this convening that we just had on Friday, we intentionally invited some Fed folks to come and hear about these tools. And hopefully we'll have some interest in continuing to move this work forward, because I think there's a lot of potential here for us to lift up how these decisions in these non-health related committees and non-health bills are impacting health and equity. And so again, we saw that we're achieving that goal in terms of health and all policies through our evaluation. One related tool I want to mention is all of you, I'm sure, can think about the impact of court decisions. And so a couple of years ago, as we were talking about the legislative health note, I was thinking about judicial decisions, and certainly we can think about ones that are directly related to health, but also indirectly related to health. And we know that there are many ways that we know that health experts tend to try to bring in those health considerations into the judicial process by submitting amicus briefs before a court decision is made. So I've been an author on an amicus brief where we lay out a number of reasons related to the ruling to try to influence the judge. But where there's a gap is once the decision is made, there's no way of assessing those potential health impacts. And so I wrote a grant and got some funding from the Bloomberg American Health Initiative, and it's a high impact project where we are taking the legislative health note methodology and applying it to judicial decisions. And so we have a team of public health lawyers that are advisors on this. And what we've done is that we focused our first case actually on a firearm access case where we just finished our first judicial note and it's out for review, but basically saying, okay, once this court decision is made and it's being implemented, what are all of the ways health can be impacted, right? Because people focus on that court decision from a legal lens, but are not bringing a public health lens to the work. And so we are particularly focusing on bills that are not central related to health, or where public health is not, or health equity is not being talked about. And so again, we just finished this one on firearm access. We're looking at the second issue around CAFOs, and then an issue related to adolescents that we're trying to lift up some adolescent health considerations. So again, another aspect of health and all policies that we want to lift up to really try to help to advance consideration of health and equity in the policy engagement process. So if I can go back to where I started about why I engage in the policy process, particularly with these tools, it's because one of the things I've seen throughout my years, particularly at the state, is that state health departments, for example, have a whole legislative team, and they do a really good job of tracking those health bills, tracking the bills coming out of health committees. But it's all of these other bills where they often don't have capacity, or they're not looking through the same lens that I am to say, well, what are the impacts of that bill on health? So in terms of this work in health and all policies, I'm engaging in the process to help inform better decisions that can promote health, promote equity, and that we can use to mitigate harms. And so that's the work we're doing. We're operationalizing health and all policies. And the hope is that we will help to influence and change the types of bills that people are putting forward because they're seeing the results of our analysis. And we have some demonstrated impact where we've seen things change because of what we've been able to highlight. So I wanted to stop there. That's sort of my slides for today before we give you some time to talk with each other. But let me see if there's any questions or comments or reactions to health and all policies, legislative health notes, or judicial health notes, or anything that you want to ask about. I welcome comments or questions. Okay, I'm not seeing any. So maybe what we can do then is, if we continue to keep our lens, our lens on, or look at things through the lens of policy engagement, one of the things that's critical for health and all policies, and for all of these tools I mentioned, is beginning by identifying, well, what's the issue that you want to address through your work? What's the problem? What's the proposal? And so what we want to do is just create space for you all to be in conversation with each other, to talk a bit about your problem statement, the topic that you're going to be looking at, the thing you care about. And so we're just going to put you into some breakout groups with your colleagues for a little bit, for maybe about 15 minutes. And Yeah, about 15 minutes, and then we'll come back and we'll wrap up. But we'll put people into groups of 3 or 4 based on the numbers here. And again, just really invite you to share with each other, talk about the problem that you are focused on, what you're finding, and really lean on your colleagues to just kind of workshop your ideas. And then we'll come back in about 15 minutes. So Corey's going to open up some breakout rooms for us, and then again, encourage you to just have good conversation and to connect with each other. So thank you. So I'm going to stop the recording because we won't need to keep this going during the breakouts. And